At We Impact Africa, we connect people who need help with those who can provide help through free medical missions. Since the early 1980s, the founders, Chinedum and Nkechi Waga, have been impacting Africa. Mr. and Mrs. Chinedum and Nkechi Waga have been in Christian ministry for over 36 years.
Paul says forgetting the past. Paul will say, we press forward. So we want to press forward.
This is what God wants us to have.
Hii ndio Bwana anataka tuwe nayo.
He wants us to excel.
Anataka tunawiri
in everything.
They have been involved in pastoring, teaching, planting churches, and doing mission work, including medical outreaches in Nigeria and other countries of Africa. Mrs. Nkechi Waga has been a nurse and has served in various aspects of the profession.
Having worked in the health industry for many years of my life, I've seen people go through medical issues, and I've seen them struggle through needs to take care of themselves, to take care of their health. Both here in Nigeria, in Africa, and abroad, I know that medical needs are important in people's lives, and a lot of people go through difficult times because they cannot afford it. Mostly also here in our country, Nigeria, and in most parts of Africa, there are people that wouldn't go to the hospital for many years of their lives, wouldn't go to see the doctors because some of them don't even afford it, just like it is in some other parts of the world.
Both in Nigeria and the United States of America, they both have experience in hospital and healthcare administration and have witnessed firsthand the problems that lack of medical care pose, especially among the poor and rural parts of Africa.
4 years ago, precisely, the Lord began to lay in our hearts the ministry that could cater for the needs of people who are sick in their bodies, especially a ministry that will use an opportunity, for ministering to people who are not well in their body, who cannot even afford their medications, and then preach the gospel to them. So We Impact Africa was born, and over these past 4 years, we have done a lot of medical missions in different communities and villages in Nigeria, in Ghana. We have done ministry in Kenya. We have done ministry in India. But our main focus is doing medical missions in most rural parts of Africa. And Nigeria seems to be our base.
They are currently the senior pastors of God's Favorite House Ministries in Aba, Nigeria, a church within the New Testament Fellowship Network of Churches, USA. Who are we? Since January 2016, We Impact Africa, in partnership with God's Favorite House Church, has carried out 5 medical outreaches in Nigeria, serving 1,500 patients, giving out 300 pairs of eyeglasses to the poor, screened 650 for cervical cancer, and have 360 volunteers, including medical doctors and other healthcare personnel. History. We Impact Africa is an offshoot of God's Favorite House Ministries in Nigeria, which was founded in November 2005. This ministry has gone on missions in Nigeria, Ghana, Cote D'Ivoire, Kenya, Benin Republic, and Togo. We have raised and currently support missionaries who presently live and serve in some rural parts of Africa. God's Favorite House Ministries and We Impact Africa have also taken a team of doctors, nurses, and medical personnel to serve in medical outreaches in some of these areas.
When God laid this in our hearts, having seen different needs, even in these medical areas, we found that we can take what we have with the volunteers, with the medical team, that can go and minister to people that need to be reached in this area. And when we go, it becomes easy for them to hear the gospel, because that is the main thing. As many people are finding it difficult to go to church or to even hear what the preaching is saying, when you now reach them, like everybody that has need, everybody that has problem, is able to listen to whatever will help. So when you bring their needs close to them, and then you're able to present the gospel, it becomes easier for people to open their heart. First of all, they will see that there are people that care about them.
We are building a health center, and a health center that will be catering to the need of people who are ill in their body, and then we use the opportunity to preach the gospel to them.
In January 2019, our outreach in Nigeria served 300 patients, gave 60 pairs of prescription eyeglasses, and screened 100 women for cervical cancer. We have a volunteer team of 12 doctors. Vision. This is an organization that over the years has recognized the stringent needs in Africa in regards to medical care and hunger in rural communities. We seek to raise support to reach these communities and meet these important needs that are not easily affordable. Many lives have been observed to be lost by what could have been prevented by simple medical interventions. This organization seeks to raise as much support so as to reduce these occurrences. How we make impact? Through health clinics, food for the hungry, disaster relief, clothing drives, shelter programs, and education. So, support us today to make more impact.